Hello everyone. The executive and the board met over the past week. We had an excellent meeting with very good, thoughtful discussion. So I thought I'd share with you some of the decisions that were taken by the board, as well as some directions that are currently under consideration. First of all, there was a solid support for continuing work on the patient medical home, but a reminder that we need to make sure that we are inclusive of all family physicians, irrespective of funding model, and that we need to continue to encourage quality improvement and data gathering on the return on investment of these new models of care. There was support for a smaller, skills-based board, and an indication that the board welcomes our continued planning for chapter symposia and forums that would enable us to discuss with representatives of chapters and our committees strategic issues facing the organization and obtain their input. So further follow-up on this will follow over the next 6 to 12 months. There was support for the creation of a Rural Education and Advocacy Task Force in collaboration with the Society of Rural Physicians of Canada. We are considering adding to the task force the voice of a patient, citizen, as well as the voice of a healthcare provider who is not a physician, working, living in a rural, remote environment. I had the opportunity to discuss this yesterday with representatives of the Society of Rural Physicians of Canada, and they were also supportive of this direction. A decision was made to lengthen by 6 months the Mainpro cycle for those whose cycle ends between December 2014 through to and including December 2018, in order to facilitate a move for Mainpro cycles to be from July 1st of one year to June 30th of the following year, starting in July 2015, when we introduced Mainpro Plus. The board was appraised of discussions underway regarding how we reflect special designations regarding certificates of added competence. This is being revisited, in part, due to concerns expressed to us by holders of the EM designation. There were also discussions about the need for Mainpro Plus participation for maintenance of certificates of added competence and for the need for us to be more deliberate for those who are holders of certificates of added competence to maintain that special designation. I also took part in a very good leaders forum on social accountability, which allowed us to reflect on our role, first of all, as clinician in meeting our social accountability mandate with each of our patients, on our role in our communities as agents of change, as well as exploring some direction that the college should take to meet this social accountability mandate. I was impressed by our shared purpose, particularly as it relates to our patients and communities, about the fact that we're not starting from scratch, but in fact it's a question of moving from good to better. And of course, as CEO, about the need that I will have to consider and make a certain prioritization of the many suggestions that were received. So I will be sharing with you over the next few weeks and months how we're progressing on the implementation of some of those decisions. And until then, have a good week, everyone.